Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, we're going to talk about chemical peels. Chemical peels come in many varieties. A chemical peel means that a chemical is applied to the face and left on for a variable amount of time. Then it is often, but not always, neutralized with water or some type of solution to stop the chemical reaction on the skin. The chemical that is applied loosens the bonds between the skin cells, creating a mild injury to the surface of the skin. Then the damaged outer layers can peel away and new skin is stimulated to grow underneath, thereby producing new keratinocytes, those are skin cells, that make up the surface of the skin, as well as stimulating collagen and elastin. The result is smoother, clearer skin. Interestingly, chemical peels work for many different conditions. We use them to treat acne, hyperpigmentation, fine lines and wrinkles, as well as precancerous sun damage. When we use the peels to treat acne, you can imagine that the exfoliation of the surface of the skin unclogs pores and reduces some acne marks. As the surface of the skin is thinned by the chemical peel, wrinkles and pores look smaller, and brown spots fade as new skin is growing. I will often be doing the same chemical peel on a teenager for acne and their mother to reduce hyperpigmentation and wrinkles. It's literally the same procedure. In our office, we typically use TCA peels. TCA is trichloroacetic acid. It comes in many different strengths. It can be used for many different things. We tend to do medium-strength chemical peels, which are really effective and tolerated by both kids and adults, as well as all skin tones. I've done these peels on children, pregnant women, and all skin colors from the lightest to the darkest. It works well for everybody, it's incredibly safe, and it's really effective. We will sometimes also use glycolic acid peels. I find these to be a bit lighter, and I prefer the TCA. Chemical peels can be light, medium, or heavy. I tend to stick mostly with the medium-strength peels. They do not have much downtime, and they give great results. The light chemical peels are just that, they're very light. Heavy peels require downtime that my patients typically don't have, so I stay away from those, but they can be very effective. In my office, a chemical peel appointment is done in a regular office visit. We often combine them with Botox or a skin cancer screening or an acne check, but they can also be done just by themselves as a standalone appointment. We prefer to start with a clean face, so if the patient has makeup or sunscreen on, we can wipe that off first. I will then personally apply the acid to the patient's face. Then we wait between 30 seconds and around 2 minutes for most people, monitoring the patient and their skin. The acid itches and tingles and burns a bit. I would not say that it's painful, but it's hot and it's spicy, and most people can tolerate it for a minute or so, although there are people who are very sensitive who can't even make it a minute. And when it becomes really uncomfortable, we then apply iced water to the face and it immediately feels better. So it's mild discomfort for a couple of minutes. The water that we apply neutralizes the chemical peel, so the effects of the peeling stop. We keep applying water until the patient feels better, which can take a few minutes. When they are done, they leave. It's quick, it's easy. The skin can be a little pinkish or whitish for about an hour or so, but it does go back to normal quickly. Makeup can be worn. I recommend to avoid any harsh skincare products for a week or so after a chemical peel, such as retin A, retinoids, any acids, azelaic acid, glycolic acid. I just recommend mild cleanser, sunblock, and moisturizer. If it's an acne patient, I do recommend spot treatment for acne if they need it afterwards, but I do not recommend their full acne program on their whole face because it's just adding fuel to the fire in terms of irritation. I do not recommend doing peels if the patient is about to be in the sun a lot, as the peel thins the skin and makes people sensitive to the sun for at least 3 weeks or so. And it also makes people sensitive to facial waxing. So depending on what areas of their face they are waxing, we have to be careful about scheduling a chemical peel. The after effects of the peel can go from absolutely nothing if the patient has thick, oily skin. The oil will often mask any peeling. Or, worst case scenario, the skin can be red, dry, flaky, and peely, and that would usually start about 2 to 5 days after the peel and can last for up to a week. Most people fall somewhere in between that, and they get a little dry and flaky, but it's not so bad. The type of chemical peel that we do is considered a no downtime procedure, but I do recommend doing the first one when there are no big events coming up, just to make sure there are no issues. I would also say that the after effects can vary depending on the condition of the skin and the weather. If the patient has been using a lot of retin A or retinoids and their skin is thin, or their skin is super sensitive and dry, or the weather is really cold and the air is really dry, the peeling can be much more significant. So the amount of peeling that you get from a chemical peel can vary by patient to patient with their skin type, but it can also vary from visit to visit and peel to peel depending on the condition of the skin, the products that are being used, and the weather outside. So I try to explain to patients that whether or not you technically peel your skin from the chemical peel, the chemical still had its effects. And in some ways, the best case scenario is to get a chemical peel and then not to have to deal with dry, flaky skin for days afterwards. So if you don't have that, then good for you. Great to get all the benefits without any of the downsides. Some people just love the experience of having their skin peel, but it doesn't always happen. So in summary, I use mostly TCA peels in my office. It's a safe and effective chemical at the strengths that we use for kids and adults and all skin tones. Chemical peels work well for many conditions. The most common conditions that I use chemical peels for are acne, hyperpigmentation, and anti-aging. Peels can also be used to treat precancerous skin growths. The peels that I perform are considered no downtime procedures, although there might be some peeling of the skin a few days later. I'd like to remind people, if you're doing chemical peels, please be careful with sun exposure, always wear sunblock. The peels make the skin more sun sensitive, and do not do them within a few weeks of waxing. I hope that helps you understand chemical peels in general and how they work in our office. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.